10:30 here in New York now. Two issues here on Obamacare. New concerns about the decision to extend the enrollment deadline, and the back end of the system we're reporting has yet to be fixed. That's an issue for many reasons. Also, with the extension to sign up, insurers say giving people more time could make it harder to calculate your rate for next year. Stan Hupfeld is a former healthcare executive, hospital CEO. He also wrote the book Political Malpractice: How Politicians Made a Mess of Health Reform. How are you, sir? And good morning to you.
Terrific. Good morning from Oklahoma.
Thank you. Thank you for your time today, and good morning from New York. Now, we know the deadline's been extended to mid-April, maybe even goes beyond that. Who knows? Just click the box, right? But with the back-end website issue, if that is yet to be fixed, what does that mean?
Well, that's a terrific problem potentially for patients who actually could sign up for coverage, pay their premium, and then expect a subsidy from the government, but because there's no direct interface between the exchanges and the insurance companies, they could arrive at a provider, and the insurance companies have not received payment from HHS, the subsidy payment, and find out, in fact, they are not covered.
So from a patient's perspective, how does it impact them? I've got a sense here that the price is going to go higher. Is that right?
Absolutely. And the second half is that when insurance companies are required to do everything manually rather than automated, the additional overhead expense is terrific. And remember, as part of the Affordable Care Act, there was this thing called medical loss ratio, which limits the amount of overhead and profit that the insurance companies can have versus the amount that they pay for medical care. So with this pressure on additional overhead, that creates a whole new set of incentives to increase premiums.
Why is this taking so long? I mean, just on the back-end system, we knew it wasn't working in October, and now we're 6 months down the road working on 7.
Yeah, it seems to me that the focus was trying to fix what was initially broken, which was what was reported in October, and they sort of left this back end to the last moment. And now it's evidenced itself, and it's going to create a huge problem if they don't fix it quickly.
But we don't know who's really covered, right? We don't know who's really paid. Do you think the administration has those numbers and they just haven't gone public?
I don't think we really know the difference between those that are actually on the website, that actually have signed up, that actually have paid a premium, and or whether the government has sent its check in to the insurance company to cover the subsidy. We know none of that.
And what's the effect of that?
The effect is as I said, a patient in good faith, assuming that they've paid their first month's premium, can show up at a provider and think they have coverage and find out, in fact, they do not have coverage. That's the worst of all worlds.
Well, what do you think of that whole honor system idea that's been floated this week? Well, not floated, it's going to happen. You just need to check a box and say, I'm interested, and you'll be counted. What's the effect of that?
It's the insurance company's worst nightmare. You know, for insurance companies, the problem that they have is the problem of adverse selection. And that's too many old and sick signing up. And so what you've done is you've given the young and the healthy an opportunity to continue to delay signing up. And with this opportunity that they could just say that they've tried and they were not successful, this honor system allows them another opportunity to sort of obfuscate and delay signing up, which again creates additional upward pressure on premiums.
Back to that question about who paid. Is it true, do you believe, that we really do not know who has paid? Or have we just not been told?
I don't think we know, honestly. I think more accurately, because it's a manual system and because there's no way to get accurate data from a manual system at this part, the insurance companies don't know, and frankly, the exchanges don't know. So perhaps we're making assumptions that may or may not be true.
Now, also there's this confusion, too. The president said on Sunday, quote, if you're an American who wants to get covered, or if you know someone who should, it's now last call for 2014. That was Sunday. It's Thursday. The rules changed again.
Yes, exactly. And we keep moving the line, perhaps for political reasons. But what it does create in the marketplace is tremendous uncertainty on the patient's part, and certainly this continued upward pressure on premiums, which we're really going to see the effect months from now.
Yeah. What are the insurance companies doing with all this back and forth, this ping pong match here? I imagine their heads are spinning. How are they dealing with it?
You know, the interesting part was the insurance industry was one of the biggest supporters of the Affordable Care Act. And of everybody who's sort of taken it in the neck in this process, the insurance companies are sort of number one. So the biggest supporter, I think, the administration has taken the most advantage of. And if I'm an insurance executive at this part, I have to be very, very disappointed in the way our industry's been treated after we were very supportive of the act to begin with.
You're very interesting to talk to, Stan. Thank you. Stan Hupfeld out of Oklahoma. Enjoy Oklahoma, okay?
Thank you.
We're jealous. See you again.